Hello, everyone, and welcome to Atp Live Monday. I am Gbemisola Boyede, and it's my pleasure to be here today for a fresh episode of Atp Live, where I get to answer any questions that you may have about the health of your children. So, welcome. Feel free to share the video, share the link to everywhere, and invite your friends and family to be part. And I'm also just going to do the same. Okay, let me just refresh my Facebook. I hope you've had a beautiful Monday. Welcome to the month of July. The month of July is so unique to us on HCP because July is HCP month. That's the month that HCP was founded. And this year, the third week of July, we'll be celebrating our 9th anniversary. That's amazing. So it's a pleasure to have been serving people for 9 years. So uh, this is July, this is ATP month. So watch out for all our events celebrating ATP. And we are just asking that if ATP has been a blessing to you and to your family, that you celebrate with us and uh, invite family and friends to celebrate with us and help us to do more, help us to bless more lives by supporting us and by uh, funding our projects. So we'll be sharing more on that throughout this month. So welcome to July. Welcome to ATP month of July. And ATP month is always followed by the breastfeeding week in first week of August. So we just go back to back like that. So welcome to ATP Live Monday. And I'm just going to share the video to all the links, all our groups. And if you're watching me on Facebook, on Instagram, you're welcome. Feel free to start asking any questions that you may have about the health of your children. I've got 60 minutes to answer the questions live. However, if you are watching a repeat or a recording, uh, thank you so much for watching. Feel free to go ahead to our Facebook group and post your questions there. That's for those who are watching the recording of this live session. Well, if you're watching the live session, just feel free to drop your questions directly on the video you're watching on, and I'll start to answer the questions in a couple of minutes. I'm just trying to share so that everybody can see and everybody can join us. So I think I'm done with all the sharing. Let me just go make sure they are all pinned and all that. Those on Instagram, thank you so much for joining us. If you have any questions about the health of your children, feel free to start to post your questions as comments under the video. Just a short housekeeping rules, please, when you're asking questions. Help us to start with the age of the child. That is the most important information for a pediatrician. We need to always know the age because that's the only way we'll be able to have the right context. Unfortunately or fortunately for us as pediatricians, we have a diverse group of clients that we deal with. So we attend to children from the age of 0 to 18 years. And that means that the way we respond will be different depending on the age of the child. The same question, but if it's a different age group, it may be a different answer completely. So that's why it's so important for you to tell us the age of the child and give us a little bit of the background information, but not the entire life history of the child. So just go straight to the point. Tell us what you think is relevant to us being able to answer your question. And then keep it short and simple. Avoid using medical jargons and terminology. Just describe in everyday words what is you observe with the child, what you've done, and what exactly you want us to address. Don't just give us information and leave the posts hanging. Some people do that and they leave it to us to figure out what to do with that information. I always struggle with that. I always want you to tell me exactly what you want me to do with the information you've provided to me. Otherwise, I won't know what to do. All right, I think I'm done with all the sharing. So let me welcome everybody once again. Welcome to Atp Live Monday. Hi, I'm Gbemisola Boyede. I'm a pediatrician and founder, CEO, Ask the Pediatricians Foundation, which is a charity registered in Nigeria, and we're committed to the health and the welfare of children globally, but especially in sub-Saharan Africa, where most of our children are still dying from preventable causes. So we do that through health education, health information, and community outreaches. And some of you must have seen us in a community near you. So we are in every state in Nigeria. So thank you so much for joining us. And this month we'll be celebrating 9 years of doing this. Amazing opportunity to have reached millions of children and families online and offline. So we're so excited to celebrate that milestone. So thank you so much for joining me today. So I'll start to answer the questions now. I'm done with all my adverts. So now let's talk about the first question I can see on Instagram. Ayabaoluwa, when does it become necessary to take a 5-month-old to the hospital after having over 39 degrees of temperature? The fact that a child has 39 degrees of temperature, you should go to the hospital. There is no when it does it become necessary. A fever that is high grade is enough for you to take a 5-month-old to the hospital because there's something causing that fever. So you should give the child paracetamol as a first aid. But the fever that is going above 39 is too high because the next thing is that the child can convulse, can start going stiff or shaking, having what we call a seizure from high fever. So if you give him paracetamol, the fever is still high, above 39, it's not going down, that child needs to go to the hospital. We need to know why the child is having fever. So please take this child to the hospital straight away so that we can investigate the child and treat the underlying cause of the fever. So Ayabolua, as you're listening to me, just pack your bags and go to the hospital now. Okay, thank you for doing that. And you can tell your doctors that you are here so that they can quickly do the needful. Omoti babe, how can I stop breastfeeding for a 2-year-old? There's no special way to stop breastfeeding. You just stop. That is it. Stopping is stopping. But we have some tips on weaning. So if you go to our website, www.askthepediatricians.com, there is an article called Simple Weaning or weaning tips for parents. So you can do that. So what we normally, there are different methods, but what I normally recommend is what I call gradual weaning. So you begin to stop the breast gradually. So if you are breastfeeding from morning to night before, you can decide to stop breastfeeding in the morning time. Then you can decide to stop the afternoon. Then you can stop the night one. You may just decide to get to the point of what I call crisis stopping. So you decide that this weekend or this week is the week and you just stop. That's it, because we expect that your 2-year-old should be eating everything the family is eating. So the 2-year-old should have been established on real family food and all that. So there's no big deal stopping breastfeeding in a 2-year-old. So you just stop. Of course, the child is going to cry and look for the breast, but you have to make up your mind. I found out that the most important thing is for the mother herself to be psychologically ready to stop, because most of you are not ready to stop, because when the child starts crying, then you start giving them the breast again, and then you know, like, how do I stop? So if you are ready yourself, emotionally, psychologically ready to stop, just stop. Then if the child cries, give other thing, give the child should be eating other food, drinking from cups and stuff. So that's what you do. We don't expect children to be eating at night anyway. So once you stop, you wear Fambras, take paracetamol or painkillers if you feel a little bit of pain. Within 2 3 days, your breasts will dry up, and that's it. That's the end of it. So no special way to stop breastfeeding. All right, be weak and waves. What can I do to stop a child from sucking his tongue? Always start every question with the age of the child. Be weak. I think you were not here when I did the housekeeping announcement. So it's very important to know the age of this child. But most of the time, that is an habit for most children. And over time, they will stop. We expect most of them to stop by the time they're about 4 to 6. Um, yeah, so you can encourage the child to stop, give positive rewards and all that, but usually most of them stop it on their own. We don't encourage so-called all sorts of things that people do and all that. So uh punishing the child and all that, most of the time it's an habit for the child, and most children do that habits either to self-soothe themselves or things like that. So you just encourage the child to stop, give positive reward when the child is not doing it and all that, and hopefully it will stop on his own. But if the child is really struggling or you're also struggling, then you can get help from psychologists and all that for children who have other deeper issues, really. But most children, they will stop on their own. Okay, 16 months old, yeah. So your baby is 16 months old, yeah, it's okay. It's difficult for you to tell a 16 months old to stop because they are still and difficult to process that information, but just leave it. Some of them just outgrow it on their own. um by the time they're about 2 3, if it's still persistent, then that's when all those positive reward and stuff may come in and all that. But just watch and see if it will stop on its own. We don't have any special approach towards that. Okay, some timeless signature say your 2-year-old is still looking for breasts. Well, there's nothing wrong. You can breastfeed for as long as you want. We recommend 2 years minimum. So if you want to go to 5 or 6 years, it's okay. As long as you, as the mother, you are happy to do it. I mean, we have no problem at all. But usually, most 2-year-old, we want them to stop breastfeeding. Okay, on. Let me come to Facebook. Good evening, Cynthia. Sorry, I'm not sure whether I pronounced the name well. Okay, say good morning. Okay, I don't know which country you are. Okay, it's this evening here in Nigeria, but I guess you may be watching us outside the country. Your 10 months old baby has these rashes on his body, it's itching. Okay, he has allergy. Okay, you've seen a pediatrician. Okay, you've done so many things. Okay, the moment I use this thing. So why did you use a new soap again? I mean, if you know what is working, then you stick with what is working. Okay, or is it the soap you were using when the child was having the allergies, or the allergies started after you changed the soap? I don't know if it's heat rash or so. Anyway, for rashes, we need to see rashes. So Cynthia, you can take a picture of the rash and put it on our Facebook group, the Ask the Pediatricians Facebook group. We can look at it for you and then we can tell you. But if you started a new product, like you said, a new soap, and the child start having rashes, then you got to stop that soap and go back to whatever you were using, and the child does not have rashes. So it's important. There are different kind of rashes. There are rashes that are just due to allergic reaction to something, and all we need to do is to stop that product. There are rashes that are due to infection, could be bacterial infection, could be um, fungal infection, so many different kind of infection. There are rashes that are due to certain skin diseases, like children who have atopic dermatitis or things like that. So it's so important to know which rash we're doing, and we can't afford to make guesses when we see each rash, or most time each rash you will know because the child who it would have been sweaty and it would have been hot, and then the child has rashes, and once you make the child cool and you take away all the you know, all the heat, so to say, the rashes will clear on their own. So heat rashes are not that difficult. But if your child is having rashes that is itching and blah, blah, that doesn't sound like an itch rash to me. Especially you said this rash started after you change your soap. That to me something has to do maybe with a reaction to the product you change and all that. So anyway, what I'll recommend first, post a picture, put it on our Facebook group with the same information you've put here, and then we can have a look first to give you an idea whether this is a infection, this is a itch rash, or this is an allergic condition. Then you may have to still go back as well to your pediatrician who was treating the child, and you know they can have a look for you again as well. All right. Hello, Solajumake. So my baby is 7 months old, but of recent started bringing out his tongue. There's nothing wrong with babies bringing out their tongue, and I don't know what you mean by bringing out. So is it sucking on the tongue or just bringing out the tongue and taking it back in? Because you really need to be very specific so we know what we are dealing with. But whichever one, whether the baby is sticking out their tongue, sucking their tongue, there's absolutely nothing for us to worry about a baby, and you don't have to do anything about it. Just leave it, and it will hopefully stop on its own. All right. Let's continue. Instagram, please. If you have asked a question I didn't say, please ask again because my Instagram comments are disappearing, so I'm not be able to keep track of all of them. Good evening, Wobich. Thank you for joining us. Ifeoluwa, sorry. Yimika Ifeoluwa Tobi. My baby will be 2 years old next week. She scratches her body and ends up having spots on her leg. What can I do? Okay, so that sounds again like an allergic kind of reaction. Maybe your baby have what we call papular urticaria. Urticaria rashes are like a form of allergic reaction, maybe to insect bites or to something, and then children are having this itch, and then they itch and they have all these spots, and they can leave black spots. So for those kind of conditions, it's just a genetic thing. The child has that tendency to react to certain things. So what we normally recommend is avoiding the trigger. You want to avoid those things that the child will react to. So if, for example, you want in the evenings you want to wear long sleeves and trousers for the child so that the legs are covered, because most of those things tend to happen towards the afternoon, evening time. So you want to make sure they are covered. You want to make sure that you keep the nails short so that when the child itch, because sometimes the spots and the rashes is from the scratching, so you want to make sure that the nails are short. Sometimes if the scratching or the itching is so bad, we can give some medication. We call them antihistamines. We call them, they are like anti-allergy, so they kind of reduce the amount of the itching and scratching and all that. But most time children just live with that, just avoid, but you can't always completely prevent it. And when they have it, they get all those antihistamine like to break the itching, and hopefully as some children get older, they tend to outgrow the all those kind of allergic tendencies. So that's all you can do for now. All right. Williams Kimari. Good evening, Doc. Please, maybe of 11 months old has an inverted navel. Okay. How do I keep it clean? The same way you keep any kind of navel clean. Just wash it and dry it and apply normal body cream, Vaseline, whatever it is you do. There's no special deal. You just wash it. If it's the inside, but you can also put your sponge or whatever you soap. Make sure you go inside as well. It's not difficult at all, and you can just wash it and make sure you dry it, and that's it. So it's not a big deal. You can do that. All right. Okay, I still don't have any question on Instagram. I'm checking. Okay, Cynthia, you're giving us an update. Your 10-month-old allergy, it has been on since it was 3 months old. Okay, he itches his eyes, blah, 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 puts his ears. Yeah, your child, you already say your child has allergy, we call that an atopy. So atopy condition is a kind of condition where a child has multiple allergies involving different organs. So they have the highest involvement, which we call it's allergic conjunctivitis. They can have with their ears, they can have with the nose, and they will have catarrh all the time, allergic rhinitis. They can have on the skin, that is allergic dermatitis or atopic eczema. They can even have bronchial asthma. They can, so some children have that allergic tendency. So we call it atopy. So your child already has all that tendency as well. So for such children, you really, really need to be careful what they are exposed to. Number one, if you know things that triggers them, you avoid it completely. Even as simple as giving them formula. So you want to give them exclusive breast milk because formula, some babies are going to react to that, and then they start having much of those reactions. Whereas babies who are on breast milk, they actually have what we call IgE and other things in breast milk that protects them against the allergic reactions. So, and just like that, maybe that's why your doctor was suggesting you don't want to, there's only for such babies to have powder or anything. When you want to use cream, you're going to use cream and soap that are what we call hypoallergenic, things that don't have chemicals in them, as natural as possible. That is the idea. So those are the things you do, but you cannot stop it completely because that child always has that genetic tendency to react to things. Some of them, as they get older, they will outgrow it a bit, but some will always still have it, and one of them is still remains, either the skin or even some may have it in the lungs where they have bronchial asthma. So if your child is having multiple of them, we call it atopy, atopic match. So it's like the child is having all sorts of allergic kind of conditions, and sometimes you may even have to be with our specialists that deal with allergies, so they can monitor the child, and sometimes they may have to put the child on medication to kind of suppress it a bit if it's really really bad. But otherwise, that is just who your child is, and it is in the child's genetic makeup, and it's not anybody's fault. It's just who the child is. If we just manage those kind of condition, we can't particularly cure it. It's because it's something in the gene, so you just have to do it. So we deal with every flare or every incident as they happen, but otherwise there's nothing much we can do about that. All right. Osas blessing say my baby has catarrh. Please always start every question with the age of your child. Is the most important information. Remember that I am sitting here. I'm not seeing any child in front of me, so I need to know which child we're talking about, and then we can answer that question. But please don't use silver bed oil for any baby. We don't recommend that. So eucalyptus oil. When you say use it, I mean don't give it to drink. Or let me be very clear about that. So if you mean I don't know how you want to use it, like put it, some people put it on the clothes or around babies for the baby to smell. Well, it depends on what is causing baby's catarrh. Most catarrh in children are due to viruses, okay, and they are going to go on their own. You don't need to do anything about it. The most important thing is to avoid exposing the child to people who already have cold and catarrh and all that. But as long as the child is not having fever, the child is not breathing fast, just leave it alone. And you didn't tell us the age of the child, so it's difficult for me to give other recommendations. But the important thing is to allow it to go on its own. But if the child is having fever, fast breathing, difficulties with breathing, then that child will need to go to the hospital, and they can deal with that. If the nose is blocked, what we recommend is for you to put in like saline drops into the nostrils, and it will soften the mucus and allow you to flow out readily. But otherwise, there's nothing else to do for children who are having catarrh. It's going to go up by itself. I hope that's helpful. But if you want me to clarify further, you can just tell me the age of your child and I will narrow down the answers further for you. Okay. Cynthia is saying, okay, yeah, exactly. Okay. My 10-month-old vomits when I give him pap and formula. I don't know if it's lactose intolerance. That is not necessarily lactose intolerance. So you give him pap and formula. Number one, how much are you giving him? What quantity? You know, how do you give it? So and then there's no law that maybe has to take pap and formula. So if you think your child is vomiting pap and formula, give other food. There are many other food that your child can eat. And if you need more information on complementary feeding, go to our Facebook group. We have guide session, and there's a complete guide on complementary feeding that has about 4 or 5 videos that you can watch on the different classes of food, on how to give it, how frequently to give it, and all that, how to mix the food. And I hope you are not bottle feeding a child. Pap, I mean, everything has to be cup and spoon at this age. So you need to watch that. Then also the quantity, because some of us, I think, we give too much to that age, because we're actually converting the amount of formula the child is taking as milk. Then we want to give the same amount as the pap. No, that would be too much. And pap for babies should be thick, not watery, and should not be given through the bottle. And for your 10-month-old, your baby needs to be on just about 3/4 of a cup. And when we say cup, that cup is about 150 mils. So 3/4 of a cup is just about maybe 100 mils or so, yeah, maybe about 100 mils. So that is a thick pap. They mix the formula inside. It doesn't have to be formula. You can use your breast milk if you want, but that is what you give your child, and give it a spoon. And don't rush the child, like they have to finish in 5 minutes. And don't overfeed them as well, because sometimes we feed these babies too much, and the next thing is that they just want to vomit everything. So you just have to make sure that you are not doing the wrong thing first before. So the last thing we are going to jump to is lactose intolerant. If your baby has been breastfeeding and not vomiting, your baby will not be lactose intolerant, because your child, lactose is in breast milk. Okay, so your baby can have what we call cow milk protein allergy, which is different, because the cow milk protein is different from what you have in your breast milk. So if your baby has taken formula before, because your baby is 10 months old, so I'm assuming this is not the first time your baby is taking formula. If your baby has been taking formula before and not vomiting, then your child is not lactose intolerant. So it may just be technique that we need to deal with. All right. So just try all that first. And then if you're still having difficulty, and is the child vomiting other food as well, is it only just pap? And if it's just the pap and formula the child is vomiting, just take it out and give other food and that the child can eat as well, instead of focusing on that. But I don't think that is enough evidence for lactose intolerance. All right. You said, what are the things you should avoid? Anything your child is allergic to, you with experience you will learn. But generally, avoid anything that has too much of chemicals, especially when it comes to body products, soap, cream, powder. You want to avoid all those ones. You want to go for as natural, as free from chemical as possible. And even down to the soap you're using to wash your baby's clothes. Some of us will use all these detergent and all that. You need to go for, some of them actually are hypoallergenic. Or when you wash, you make sure you rinse your baby's clothes at least double rinse, so that all the soap, powder, you don't use too much soap when you're washing clothes for babies, just a little. Most of the time their clothes are not dirty anyway. It's not as if they've gone to play in the mud. So make sure you and rinse it thoroughly, so that all those, well, sometimes it could just be as simple as that. Even sometimes the smell, some of you use a lot of perfumes on yourself, your babies are reacting to some of those things. Sometimes it's what you are also eating yourself being passed into the breast milk. Your child could be allergic to it. Actually, some of us that like all these flavors, strong flavors, you're adding the ginger and the curry and all those. Sometimes your children could be allergic to all those things. So if you have a child who has sensitivity, allergic sensitivity, you are also going to be very alert to everything that child is being exposed to, and you are going to reduce them as much as possible. I know it's nearly impossible to, and sometimes we don't even know what it is they are reacting to, but at least the one you can reduce, the smell, the smoke, the chemicals, and the even formula, the food, even the creams and the soap, if you can reduce as much as of them as possible, at least that will reduce the chances of all these reactions. But I know it's almost impossible to eliminate everything. Okay, Faith Emmanuel, my 3-month-old, sometimes I notice a pulse-like odorless discharge in our vagina. So there's nothing like pulse-like odorless. What's the color of this discharge? That is the most important information I need, Faith, okay? Tell us what's the color. Is it yellow? Is it white? Is it brown? That is the most important information if your 3-month-old is having vaginal discharge. So you repost and let me know what's the color of that discharge. Then I will tell you whether I'm worried or not. Okay. Okay, Osas, your baby is the 7 weeks old. So your 7 weeks old should not have cancer. Your 7 weeks old should not be exposed to people, adults. So if a 7 weeks old has cancer, it's from siblings, daddy, mommy, all the people that are coming to visit the baby. So keep your baby away from them, all right? And make sure you're breastfeeding exclusively. Make sure you keep the baby warm. No water, no formula, breast milk only, no smoke around the baby. Don't take baby to the kitchen. All your perfumes, all the insecticide, mosquito coil, whatever, avoid them. These are the things that make babies to have all this irritation and have catarrh. And that's all you need to do. Just get rid of all the things that baby should not be exposed to. You don't really need to add anything. Avoid too much the silver belt. I don't usually recommend, but if some people put it around the clothes, what it does is I just make baby to sneeze. It just induces sneezing. So if the baby is having blocked nose, when they sneeze, obviously the catarrh will come out. But the most important thing is not even that. The most important thing is that the child is not exposed and the child is allowed to build up their own immunity and fight infection. So breastfeeding exclusively, very, very important in protecting against respiratory infections. All right. Okay, I have a question on Instagram, so let me answer it before they disappear. So Clara Paul said, I noticed some small, small things in my baby's face. Okay. What is the small, small thing? Do you mean like rashes? When it bursts, it look like pimples? But see, how old is this baby? She's 2 months, 2 days, 2 years, 2 weeks. Always write your questions complete. It's very important. For me, two doesn't really make any meaning. It has to be complete. Is it 2 days? Is it 2 years? Is it 2 months? Is it 2 weeks? Because all of them could be correct. So please let us know which one it is. 2 years. Okay, thank you. So we need to see rashes before we can make up our mind. But if your baby is having what look like rashes, like bringing out yellow dry mucus and later blood, that sounds to me like pus. There's nothing like yellow mucus from a rash. So if you have what look like a little boil or like a small raised rash on your baby's face, and when they burst, it comes out with what look yellowish and with blood, that sounds like a small boil, or which is the form of a bacterial infection. You really need to take this child to the hospital. The child will need antibiotics. Please don't bust those those rashes. Don't bust them. The face is a very sensitive area because the blood supply around the face, they go straight into the brain. Okay, so if you mess up anything around the face, it can transfer those infections straight into the brain of the child, which can cause a very serious complication. I won't bother you with all the medical jargons, but when babies have, there's actually what we call the triangle area of the face. When children have boils or infection, pimples, whatever around the face, please don't pick them. Don't bust them, leave them alone. I know a lot of parents were tempted to always, press pimples, press, but don't, please, on the face, don't. Just take the child to the hospital. This child, what you described to me, the yellow, the blood, sound like a child who is having like a form of a boil, maybe small ones. This child will need antibiotics. That's what you need to do. Don't press it. More importantly, hygiene. Let's learn to wash our hands. And for 2-year-old, you have to start teaching them how to wash their hands, because most of the time it's from their dirty hands and they rub it on their face, and so they transfer the germs to their face. So just encourage them to wash their hands. When they come back from school, let's make sure they wash their hands, have a bath, just increase the hygiene around the baby, keep the nails short, keep the hands clean. Always encourage them not to always be touching their face. I know it's hard for children, but That's the best we can do. But I think that's the most important thing, to get it treated and also to prevent it from happening again. All right. Heidi Fagbemi is asking, excuse me. I just want to remove the one showing. Yeah. He said, my 5 month old, when he wants to eat or eating, is always scratching his ears and hair. That's babies just enjoying the food. There's nothing wrong. So there are some habits babies do when they are having a nice time. So they can be rubbing their hair, they can be rubbing, some will be, kicking their legs up and down. That's just habits. It's nothing. Nothing is wrong. It's not hair infection. If your baby has hair infection, it will not be only when baby is eating. Number one, the child will be rubbing the hairs and they'll be crying. And when you touch their hairs, they will cry. It will be painful. So if you think your child is having hair infection, pull on the hairs and see whether the child is crying or the child is otherwise indifferent, and also see whether is there anything like pores coming from the hair. So if a child is having hair infection, they won't be sucking and pulling on their hair. They will be pulling on their hairs all the time and they will be crying and it will be painful for them. So that is how we know the difference between the two. So don't need to worry. All right, you're welcome. So let me go back to Instagram people. I mean Facebook, sorry. Okay, Cynthia, is today's your day. He has never taken formula. Okay. He doesn't vomit home food, only the formula. Maybe the what formula? So I suspect this is maybe a cow milk protein allergy. So you're on exclusive breastfeeding before, and now you are trying to introduce formula, and the child is vomiting it. So most likely this child may not be tolerating the cow milk, not necessarily lactose, because breast milk is also lactose. So it is the cow milk. So there are alternatives. Number one, we can give dairy-free milk. So we have milk that are not made from cow milk. So you can try something like soya based or plant-based milk, for babies. So usually people give I'm trying to remember the name. The name just went off my brain. Immediately I mentioned it now, but it is based on soya. When I remember, isomil. Yeah, isomil is a soya-based formula. It is not cow, so it's a dairy-free milk. So you can try that. So look out for dairy-free milk. Another one, milk that is not made from cow milk, maybe for, so try that first, see whether your baby is able to tolerate that without vomiting. If that is it, then just cow milk protein allergy, and all you need to do is to stay away from cow milk protein. Some people are allergic to it. All right. FCBA no go in a do. Please, my baby is 8 months. She hasn't started teething. There's something to worry about. Some babies may never bring out their first teeth until they're about 13 months old. And that is absolutely normal, perfectly normal. So if your baby is 1 year old, you can see the dentist. Teeth or no teeth, just see the dentist. That's when the dentist wants to see the babies for their first dental appointment. So no need to worry, FCBA. That's my sister's name. Nice name. Adams Ajaraz. Good evening. My 15 weeks old. I've been coughing for the past 3 days and also passing loose stools after breastfeeding. Do I need to give him any medication? When you say loose stools, is it watery or is it normal stool? Because usually babies on breast milk. Okay, you didn't. Okay, all right. Is already on exclusive breastfeeding or not? Because you didn't mention that, but you just say breastfeeding, so I need to be sure. If it's on exclusive breastfeeding, babies on breast milk don't pass hard stools. Their stools are actually like loose, but they don't sink in the diaper like urine. So you need to be careful. You need to let us know whether we should worry about the stool or not. That is number one. But the coughing, yeah. The coughing, is there any fever with the coughing? Is the child breathing fast? Is the child breathing with difficulties? Those are the information that we need about that cough. If the child is just coughing, not so bad, no fast, no fever, no fast breathing, no difficulty breathing, you can just watch it for now. Most likely there's somebody else coughing in the house that has exposed the baby. If it's a viral one, he's going to go on his own. But if the child is also having fever, the child is coughing continuously and coughing to the point of vomiting, and or the child is having difficulty with breathing, or the child is breathing too fast, then you have to take the child to the hospital. Because the most important thing we need to be sure is that this child is not having pneumonia. Pneumonia is a chest infection in the lower respiratory pathway, and that will require antibiotic treatment. But ordinary cough, usually in the upper airway, just like the cough and the catarrh that are just in the upper part, no fever, no fast breathing, no difficulty with breathing. For those ones, we just watch them and they will go on their own within 2 weeks. So, but if there's any sign of pneumonia, then you have to take the child to the hospital. So let us know which one it is. Okay, let me come back to Instagram people because the question. Okay, you said no fever, no fast breathing, it's on exclusive breastfeeding. Okay, so I'll say just watch it for now. And if you notice any of those other things I mentioned, or if you notice the cough is getting worse, or the child is, having all the other signs we've mentioned, then please take to the hospital. Please don't self-medicate babies. Don't give any drugs. If you're not happy, you're worried, you have to bring the child to us, please. Okay. Ifeoluwa Oyinloye, good evening. My baby is 2 months plus, okay, but he does not sleep deeply, okay. He sleeps lightly, okay, and always cries when he wakes up. Is this something to worry about? There's nothing to worry about somebody sleeping lightly. It's just everybody, usually for babies, most of us, we're always very noisy people. So when you have babies, everybody learn to be quiet. Babies like quiet environment, not too noisy, because every little sound, can disturb them. But there's nothing absolutely wrong with that. The most important thing is that your baby is sleeping. Okay. And for me, what matters is how many hours of sleep is your baby getting in 24 hours. That's the most important information that I need for this baby. So let us know that if your baby is sleeping, how old is your baby? 2 months old, nothing less than 12 to 14 hours a day. That is what we expect a 2 months old to be clocking in terms of sleep. So usually after every breastfeeding, baby should sleep 2 to 3 hours and wake up to breastfeed again. So that should be fine. And sometimes they tend to be more awake in the night and sleep more during the day. Again, that is also fine. Over time, the circadian rhythm will change, and then they will be like the rest of the family, sleeping more at night and awake during the day. But there's nothing to worry about. And babies cry for everything. So there's nothing wrong with babies crying when they wake up. They cry when they want to sleep, when they want to wake up, when they want to eat, when they want to pass, stool, urine, farts. So there's absolutely nothing wrong with crying, because that's the only language babies speak at that age. All right. Tweety Liz. My son is 4 years old and is always tired. Okay, you need to take the child to the hospital. We need to know why the child is tired. It is definitely not normal for a baby to be tired. So we want to do minimum. We do a food blocker. And what is the PCV level? Is this child eating his food, or is somebody eating his food in the school? All those kind of stuff. Minimum things first. We need to check that the iron level is not low and all those stuff, because we can easily correct that. If his iron is low, he's anemic, we can give him iron supplements and all that. So we check that first, but we also need to check that there are no worms. Make sure you have the worm in every 6 months. And sometimes, because children can be eating and the worms are just taking all the food, so they will be tired as well. So, but if they did all the basic ones first and there's no issue there, then we can look for other causes of tiredness, which are more serious. We check the hearts, check the lungs, check all that. But most of the most common cause usually is that children have low blood level, anemia. That's the most common cause of tiredness in this particular age group. So actually, if they are not eating their fruits and their veggies and they are not eating well, it could be, or they're only eating junk. So we can check that first. So just check. Don't dismiss it, because sometimes parents tend to dismiss it a lot. We think it's just they're just playing around. So make sure you take them to the hospital for a proper check and make sure the doctor check him. It's important. All right. Kafila said, what can I use for 13 months old to stop every week catarrh from the nursery? Okay, take the child out of the nursery. That is what you need to do, really. That is the answer. Take the child out of the nursery, because as long as your child is going to a daycare, which is the real name for the nursery you're calling it, the child is going to get exposed to other children who have cough and catarrh. And one child is getting better, the other one is picking it up. And ideally, the nursery should not be taking the children who have cough and catarrh in, but you all know, you parents are also not going to agree, because you all want to go to work, so you bring the child in with the cough and catarrh. So the nursery takes them, and the child will pass it to every other child. As this one is getting better, the other one is bringing it back. It's always a vicious cycle. So the best option for that, if your child is always having consistent cough and catarrh, just take them out. That's all. Get a nanny, stay at home with the child. That is the best you can do. Otherwise, the child will keep on having it. And that is actually the brutal, honest truth. Okay. Other option is to look for a nursery or a daycare that have a very strict policy on sick illness policy. So if a child is having cough catarrh, the child cannot come in, or they're going to keep the child in a separate section with a different caregiver. As long as the same caregiver, all the children are together, is the number one reason why children have recurrent respiratory infections. Once they go back into school, daycare is a risk factor for respiratory infections. So if it is possible to keep the child away, that's what you should do. All right, Fioluwa said, does not sleep more than 20 minutes after breastfeeding, especially during the day. It sleeps less than 12 hours. So then you need to check your breastfeeding. You need to make sure you are breastfeeding your child properly. You need to make sure your child is well attached to the breast, because when your child is well attached to the breast, they will suck well. If a child is well fed, we expect them to sleep 2 to 3 hours. So, but if they are only sucking on the nipple, or sucking very, for a very short duration, less than 5 minutes, or even, so that means they've not taken enough breast milk, and they will get hungry quickly again, and they will need to suck again, and that is why they will keep waking up so quickly. So you really need to, if you're on Facebook, you go to our Facebook group. We have a guide session on breastfeeding, and the most important thing when it comes to breastfeeding is attachment of the baby to the breast. The baby has to suck on the areola. So August, first week of August, we come full circle again to breastfeeding week, and we can again talk about it. So the baby has to be well attached to breast and suck on the areola, and the baby has to suck enough to empty the breast. So the beginning part of the breast milk, we call it fore milk. It is mostly watery. It's like taking water to quench the thirst. The end part of the milk, the hind milk, that is the part that has the fat, and that is the part that provides satiety. That's the part that makes the child to be full. So you need to make sure your baby is well attached to the breast, your baby is sucking well on the breast, your baby is emptying the breast, and you are alternating the breast. Some of us tend to feed our baby on just one breast because it's so easy. That's your uh, dominant part of your hands. Make sure you always remember to change it. So if your baby finish on the right, then put on the left. You must alternate your breast, and your baby have to suck well. So usually when babies suck fully well, 10 to 20 minutes, they will be full, they will sleep, and they will sleep for nothing less than 4 hours, at least 2 to 3 hours minimum. So that is what we expect for this age group. So pay attention to that and see whether it makes any difference as well. Yeah. Okay. Okay. Lily leads. Okay. Well done, my insightful session. How many hours of sleep is a 4-month-old baby? Okay, so we actually have a chart on sleep duration, and let me just start by saying that this is a average. So don't get too fixated on the hours. It's just average. So averagely a 1 month old, let me see whether I can get it out of my phone. A 1 month old should sleep at least 16 to 20 hours. They spend most of their day, most of their life sleeping. Whereas the by 2 months old, it goes down to maybe 12 to 14 hours. And then by by 4 months, that could also be about 12 to 14 hours. Let me just get the stuff out so that I give you the right quotation and I can quote properly. But again, the most important thing, at least for that age group, want them to sleep nothing less than 12 hours a day minimum. Okay, yeah, I got it down. So less than 2 months, so it should be 16 to 20 hours total average in a 24-hour period, and they should have naps. So naps is different from the total duration of sleep. So naps is the one they take, during the day. And then 3 months old is about 15 to 18 hours. 4 months old is about 15.5 hours. So your baby, Lily should be getting about 15.5 hours. 3 to 5 months old, 15 hours. 6 months old, 14 and a half hours. 7 months old, 14 to 14 and a half. 9 months old, 14 to 14 and a half. 10 months old, about 14 hours. 11 months old, about 13.5 to 13.75. 12 months old, about 13 again to 13.5. 15 to 18 months old, about 13 to 13.5. 2 years old, 12 to 12 and a half hours. So your sleep duration goes down as the age goes up. Usually by the time they are teenagers, if we can get 8 hours, we are happy. If we can get 6 hours, it's fine. All right. So, but usually for the babies, they tend to sleep more. So for the person asking me question, for 4 months old, it should be at least 15.5 hours. But again, this is average. Your baby may sleep a little bit more, your baby may sleep a little bit less. As long as your baby is not too far off, In fact, any baby getting less than 12 hours below 6 months, I would be worried, So that is just an average, but don't get too worried about it if your baby doesn't do exact number of hours that we've quoted. It's just average. Understand it. When we say average, means 50% of people will do it that way. Some people will do it a little bit more, some people will do a little bit less. It is still fine. It's just an average. All right. Let's go on. Faith Emmanuel, you have not told us the color of the discharge of your baby. I really need that color because if it's a whitish discharge from the vagina for babies, it is absolutely normal. That is the effect of the mother's hormone. There's nothing wrong. You don't need to do anything. But if there's anything else like brown or yellowish, suggesting infection, then you have to take baby to the hospital. So I think I've answered your question just in case you've gone away. Okay. Okay. Faith, you're saying please, but you didn't actually answer the question that I asked you. Anyway, Abba said they have my 4-year-old is always biting his teeth. Biting teeth. How do you bite teeth? You mean grind his teeth? Okay, so grinding teeth or bruxism, yeah. Yes, you should be worried because we need to be sure. It could just be an habit, but sometimes it could be a sign of a subtle seizure. So I would recommend first to see a dentist so that they can do the dental part of things. If it is nothing dental, then you have to see a pediatrician. We need to be sure this child is not having what we call sleep apnea. Is your child snoring while sleeping and all that? We need to be sure the child is not having due to lack of oxygen getting to the brain, having a small form of convulsion. So it's important to be sure which one it is. If you go to our Facebook group, we actually have a group discussion, a video by a dentist addressing the topic of teeth grinding or bruxism, and it would be nice for you to watch it and then see. It may just be an habit, which is fine, but then the dentists also don't like the habit because it wears down the what we call the enamel, the white part of the teeth is kind of, it will be white, wearing it down, which is not good. So they can give you some strategies on some devices to separate them and to reduce it. But if there is more to the medical aspect, then we the pediatricians have to see the child. We need to make sure there's no sleep apnea. We need to make sure there are no seizures. So that is what we can do. All right, time has flew so by. Okay. All right, lady, say you asked 2 questions. Okay, you asked about sleep, and then how many wet diapers in a day is the child supposed to have? You're 4 months old. There's no fixed rule, but your child should pass urine almost every time you feed the baby. So for your 4 months old, if you feed your baby at least 6 to 8 times, then that is the amount of wet diaper you should be having minimum as well. So each time you feed your baby within 30 minutes, it should be a passing urine. Some may also pass stools, depending, but sometimes the stools may not necessarily pass it every day. They may not even pass it for up to a week if your baby is on exclusive breastfeeding. But the wet diaper should be not less than 6 to 8 times a day. Okay. I hope I've answered your second question. So my time is up. I need to run. But yes, if your baby is snoring, yeah, the child may be having some form of sleep apnea. So you really need to see a pediatrician or ENT doctor so that they can take it up from there. Because it may be the child has some adenoids, and sometimes all we need to do is to take care of the adenoids, and the snoring will stop, and the teeth grinding will stop as well. Jessica, yeah, my son is almost 2 years. How many words is he supposed to have? Because he has more than 20 single words. Yeah, that is 20 single word is fine for a 2-year-old, but more importantly, for a 2-year-old, you try to start combining the single words together. So the rule of the thumb, which I normally teach parents, because as a developmental pediatrician, that's my field. 1-year-old, one word. That means single words. A 2-year-old, 2 words. That is 2 words together. So mommy, car, mommy, biscuits. That's what we expect from a 2-year-old. You should start combining words together. So it is not just a single words. It is a combination of words that we expect from a 2-year-old. 3-year-old, 3 words. So 3-year-olds should be speaking sentences with a verb. I want water. I want juice. That is what we expect from a 3-year-old. 4-year-old should be able to speak like an adult. So when I talk to a 4-year-old as a stranger, I should be able to understand a 4-year-old. The 4-year-old should be able to understand me with complete, correct grammar, tenses, everything. So a 4-year-old should be able to have a full-on conversation. So that is what we expect. So if your child is not getting to that milestone, you have to see a speech therapist so that they can take it up from there. So Jessica, it's not just a single words, it's a baby combining the words together. That is what we want now. So if not, you may want to take it next and see a speech therapist. Really, if there are other concerns as well, because I believe for you to have asked that question, you must have had some concerns about your baby. So it's best to just see a speech therapist, and then you will take it up from there. All right, thank you so much, everyone. I'm doing so well for time. Got a minute left, so thank you for joining me today. Welcome to the month of July. It is ATP month. July is our month. We celebrate our 9th anniversary of bringing health education information to parents, caregivers of children in Nigeria, outside Nigeria. Believe it or not, ATP is present in over 100 countries of the world. So we reach a lot of people, and we are grateful for that. So watch out for our anniversary program. Join us, support us, donate so that we can keep on doing more of this. On Thursday, I'll be teaching on another important topic that has to do with the health of our children. So watch out for that. Thank you so much. If you still have questions, the live session is just going to be over, but you can still always post your questions on our Facebook group. So go to Ask the Pediatrician Facebook group. You can't miss our Facebook group on Facebook. You can post your questions there from Mondays to Saturdays, and any time of the day we'll be there to answer your question. Give us a little bit of time. Be patient. If there's something that's an emergency, please do not post on Facebook. If a child is very ill, a child has had an accident, a child has collapsed, whatever, please go to the hospital. But if you want to ask, how many hours of sleep your baby should have, how many times the baby should pass their, urine, all those kind of non-urgent, health education information, you are welcome to post it, and we'll do our best to answer you within 48 to 72 hours. But if it's urgent, please come and meet us in the hospital so that we can deal with that. So thank you so much for joining me. I'll see you again same time next week by God's grace. But watch out for ATP Hour on Thursday, 10 a.m. Same platform you're watching now, whether on Instagram, on Facebook, on YouTube, we'll be there and we'll be there to learn. For those of you who have not watched last week's episode on cholera, please do. There's a cholera outbreak in Nigeria, especially in Lagos State. It's important for us to know how to protect our children from cholera and how to prevent it as well. So feel free to watch the last week episode. Thank you so much for joining me. I'll see you again on Thursday and next week for ATP Live Monday. Bye. Bye-bye.